Did you know that if you were a banana in a store, the healthcare system would much rather have you rotten than healthy? It sounds absurd, but the reality is that people are making billions of dollars precisely because you're not well. And today, I'm going to show you how this game works, why getting sick is the most lucrative business in the world, and the terrifying difference between what you pay and what someone across the ocean pays for the exact same thing. Stick around because by the end of this video, you'll understand why a simple pill can cost as much as a luxury car and the secret Big Pharma doesn't want you to know about curing diseases. Imagine you go to the supermarket to buy bananas. Normally, the seller wants the banana to be perfect, yellow, and ready to eat. You pay for the fruit and leave happy. A fair exchange, right? Well, in the healthcare business, the rules change. Imagine that same seller gives you the banana for free, but only if you sign a contract promising that if the banana turns brown, you'll pay him $500 for every black spot that appears. Now, what do you think the seller wants? For the banana to stay healthy or to rot as quickly as possible? Exactly. Welcome to the sickness economy. This is where the first big problem comes in. The incentives are backwards. In a normal market, success is measured by results. In the traditional healthcare system, especially in the US, success is measured by volume. More tests, more consultations, more surgeries, more spots on the banana. If you get cured today and never come back, you're a bad customer. But if you develop a chronic condition that requires a daily pill for the next 40 years, congratulations, you've become a lifelong premium subscription. And here comes the first open loop of the video. Did you know there's a pill that costs €4 in Spain, but in the United States it can reach $400? In a few minutes, I'll explain the technical reason behind this legal robbery. Let's talk about the silent threat. Why is it so expensive to get sick? It's not just the doctor or the hospital, it's the layer of middlemen you don't see. Back to the bananas. Imagine that to buy that banana, you have to hire a fruit manager, the insurance, who in turn hires a peel negotiator, the PBM, to talk to the farmer. In the end, the farmer gets 10 cents, but you pay $15. Where did the rest go? To the glass offices of people who have never even touched a stethoscope. These middlemen are called PBMs, pharmacy benefit managers. Their only job is to negotiate prices, but instead of lowering the price for you, they keep a commission for every drug sold. The more expensive the drug, the bigger their cut. Do you see the conflict? In Europe, the system is usually different. The state is the only buyer. Imagine the government saying, I'm going to buy all the bananas in the country. You either sell them to me for 10 cents or you sell to no one. The seller has no choice. They lower the price. But in places where that single buyer doesn't exist, like in the US, every hospital and every insurance company negotiates on their own. It's the perfect chaos for prices to inflate into the stratosphere. It's a guerrilla war where the only one who gets hurt is the patient. If you have a small insurance plan, the hospital charges you triple because you have no leverage to negotiate. If you don't have insurance, they charge you the list price, which is basically science fiction. Have you ever wondered why there are no definitive cures for many things, but thousands of treatments for the symptoms? It's the maintenance trap. Think about it. A cure is a one-time sale. A symptom treatment is a monthly rent. If I sell you a patch so the banana doesn't look rotten, but the banana keeps rotting inside, you'll buy patches from me forever. If I give you a new seed that never rots, my business is over. Look, I'm not saying doctors are villains. Most want to save you. The problem is the system they work in, a system that punishes prevention and rewards emergency intervention. If a doctor spends an hour explaining how to eat to reverse your diabetes, the insurance pays them peanuts. But if they prescribe expensive insulin in 5 minutes, the system flows. The doctor's time is being bought by Big Pharma, not your well-being. Let's talk about arbitrary pricing. This will blow your mind. If you go to a hospital in New York for a broken leg, the bill could be $30,000. But if you ask for an itemized bill, that is, the line-by-line breakdown, you might see things like Tylenol, $15, a paracetamol pill that costs 5 cents in the pharmacy. Why do they do it? Because they can. Because when you're there with a broken leg, you're not price shopping on Google. You're a hostage of the situation. They even charge for skin-to-skin contact after childbirth. They literally charge you for holding your own child. If that isn't the definition of a soulless business, I don't know what is. And here's another secret. If you ever receive an astronomical medical bill, the simple act of calling and saying, "I can't pay this, give me the cash price for people without insurance," can slash the debt by 70% instantly. Why? Because the initial price was a fantasy, a number made up to negotiate with insurance companies. It's like a flea market haggle, but with your life on the line. But wait, it gets darker. Let's talk about innovation. Pharma companies always say our drugs are expensive because we invest billions in research. And yes, research is expensive, but did you know that most big pharma companies spend way more on marketing than on research? They're spending more money convincing you and your doctor that you need their special blue banana than actually making the banana better. Plus, a lot of basic research is done with public money, your taxes, at universities. Then, private companies patent the result and sell it back to you with a 10,000% profit margin. It's like you paid for the truck's gas, the driver's salary, and then they charged you for the banana at the price of gold. Let's talk about evergreen patents. Do you know what they do when a 20-year patent is about to expire? They change one insignificant molecule that doesn't even improve the drug's effect, give it a new name, and boom, another 20 years of monopoly. It's like the banana seller putting a new sticker on the old fruit and saying it's now Banana 2.0 just to keep charging you $500. And the worst part is, the law lets them do it. Now the moment I promised you. Why is the difference between the US and Europe so massive? It's not just socialism versus capitalism, it's a matter of bargaining power and patents. In many European countries, if a company sets an abusive price, the government has the right to break the patent and let others manufacture the drug cheaper. It's a real threat that keeps prices low. It's called compulsory licensing. It's the nuclear button governments use so big pharma doesn't cross the line. In the United States, the pharmaceutical lobby is so powerful that they even banned the government by law from negotiating drug prices for decades. Imagine a world where the biggest buyer of bananas is forbidden from asking for a discount. It's madness designed to empty your pockets. Only recently has this started to change slightly, but the resistance is fierce. There are more healthcare lobbyists in Washington than there are politicians. For every congressman, there are 2 people paid by the industry to whisper in their ear not to lower prices. So what's the solution? Are we doomed to be rotten bananas forever? The key lies in transparency and prevention. The system hates it when you take care of yourself. The system hates it when you eat well, exercise, and understand how your body works, because a healthy citizen is a citizen who doesn't consume healthcare. A healthy body is Wall Street's worst nightmare. Every time you choose to prevent rather than cure, you're hacking the system. You're deciding not to be a customer for their eternal subscription. To wrap up, I'll leave you with a reflection that might change how you see your next doctor's visit. The next time you're prescribed something, ask, is this to cure the root or to mask the symptom? Is there a lifestyle alternative I can try first? And above all, remember the itemized bill trick if you ever get a scare at the hospital. That simple step can save you thousands of dollars. Don't accept the first number they give you. Ask for the financial assistance policy. Almost every nonprofit hospital has to forgive debts if you earn below a certain amount, but they'll never tell you unless you ask. The healthcare business is complex, but at the end of the day, you own your banana. Don't let anyone profit from you rotting away. If this video opened your eyes, share it with someone who still thinks drug prices are fair. Knowledge is the only medicine they can't charge you for. And if you want to know what happens to the food industries are in cahoots with this system to make you sick faster, subscribe because that'll be the topic of our next video. What you're going to discover about sugar and processed foods will make you want to throw half your pantry in the trash. See you in the next one.